thank you, Brooke. And I just took a brief tour of the facility here, and it's really impressive what they have done. And actually, Representative O'Neill was sharing with me the Washington County statistics. It's impressive to what Washington County has done. I think you're in the top 10 of the 67 counties in Pennsylvania. And we're Representative O'Neill and I are on the joint bipartisan task force on vaccines, and the first thing we always do is look to see where we stand as a state. And when we started, we weren't doing so well. Now we're always in the top 10, so it's really a nice thing to see on first doses. I also, Brooke, if I can, want to just say, I know you've already given this award, but make congratulations to the Washington Health Systems recipients and honorees of the awards for doing such an amazing job in terms of serving the people here. And I don't know, is this you guys back here? So if I pronounce your name wrong, I want you to forgive me, okay? But I have Dr. Tony Aprea. Aprea, sorry. How did I start off the wrong pronunciation right away? Jane Lucas. Did I get that right? Yeah. Sandy Hlipala? Lapala, sorry. Thank you. Regina Davin?
Regina's not here today.
Okay. Bridget Trump? It's a famous name, Bridget. Jeff Murray? Jeff. Dr. Nadine Donacci? And is it pronounced Donacci? My wife is Italian. She would say that's Donacchi. Okay. Don Faust. Don. Shelley Popek. Shelley. David Truxell. Frank Gladys. Did I come close to pronouncing that correctly?
You got it right.
Okay. Lynn Bueller?
Lynn
Billar. Okay. Dr. Lisa Goss. Dr. Goss. John Lucas. Are John and Jane related? No? Okay. Okay. Doug Rohr. Doug. Julie McAvoy. And Sarah Schumacher. Sarah's over here. Did I miss anybody? Did I miss anybody? Well, again, I know you received. Who did
Robbie Hassan, Dr. Robbie Hassan.
Dr. Hassan. Sorry about that. But thank you. Did I miss anybody else? Okay. Very nice to meet you. Thank you for everything that you've done. I mean, I know the award is much more eloquent than I could ever be, but it's folks like you who actually make Pennsylvania safer. One day at a time, one patient at a time, one Pennsylvanian at a time. So thank you for everything that you've done. Really appreciate that. And again, thank you, Brooke, for everything that Washington Health Systems has done. This is really nice to be here and to see what's going on. I think tomorrow and Friday we're going to try people just walking in. You don't no longer need an appointment. So this is really going to be a thing. And also, I think the experience that you've had here has really helped inform us at the state level. I know Representative O'Neill has brought the experience here to the state, and we were just talking about things that we might do to address the next stages. The first stage was always there wasn't enough supply. Now we're at the stage where the supply is becoming more adequate. We need to make sure that the demand stays there, because we're about 50% of the population has gotten it first dose, and we need to keep moving through that. But you in this and so many other things that you do, you provide a crucial healthcare services to the people in southwestern Pennsylvania. Your dedication, sacrifice, especially during this pandemic, which, as we know, for you especially and for your staff, has been really hard, has really helped keep our communities safer. Since COVID became available, the vaccines became available, my statistics are you've done 43,000 doses. Is that about right?
I think it's up to 47.
47,000, so okay, a couple days out of date here. And the staff at clinics like this really want to do even more, which is why you're opening up to walk-ins tomorrow. Because we all know when Pennsylvanians get the vaccine, we all get safer. They get safer, obviously, because they're getting the vaccine. but we all get safer because that gets us that much closer to herd immunity. The partnerships that we've had with local health systems and vaccine providers have really been important, and we keep looking at how we can make that better. But this is an example of how that relationship has really worked. Not the relationship that we have with you, but the relationship you have with the community. It really makes a difference. Local vaccine providers know their patients like you know your communities, and you've already done the hard work to establish trust. And we were talking about how we can maybe even improve on that as we move forward. When people who aren't sure about getting a vaccine can get information and a vaccine from their trusted health care provider, that does a lot to address the concerns about hesitancy, and that's really important. The healthcare heroes here, all you folks, and across the Commonwealth are the reason why Pennsylvania's vaccine rollout is going so well. Back in the beginning, we weren't talking like this, but now we are, and I'm really proud. Nearly half of all eligible Pennsylvanians have actually had the vaccine. Actually, it's 48.1% as of this morning, as far as I can tell. And we continue to rank regularly among the top 15 in the country. Today, and for the last couple of days, we've actually been number 10. And we're actually, do I sound like I'm bragging here? I am. We're number 1 in first doses among the 10 most populous states in the country. And so I think, I'm really proud of what we're doing, but that's not us. That's what's happening here on the ground in places like Washington Health Systems. So this is really important. We need to keep making good progress. We need to make sure that we're vaccinated. And keep in mind, obviously we need to be vaccinated to keep ourselves safe, but this vaccine is only available for Pennsylvania Americans over the age of 16. So if you're below the age of 16, we're helping you by getting the vaccine, because that's really important. So any child under 16 is also being helped by our willingness to get this vaccine. For parents who want to keep their kids safe, this is important. For grandparents, and I'm now a grandparent, who want to visit with our grandchildren for the first time in way too long. For older siblings preparing to come home from college or for the summer, best thing you can do is to get yourself vaccinated so that you can keep all of them safe. When you get vaccinated, you're protecting yourself, obviously, but you're also protecting the people around you, especially the people who can't get vaccinated yet. And for the people who are just too busy or have too many worries, I hope we can help alleviate some of those burdens. Right here at Washington, they're trying to do that by allowing for walk-ins tomorrow and Friday. COVID-19 vaccines are available to everybody over 16 at providers all around the Commonwealth, and I think we just added 200 more providers yesterday. Many clinics have weekend or evening appointment availability for people who can't take the time off during the weekday. And perhaps most importantly, and here I'm going to say this a couple times, the COVID vaccine is free, absolutely free of charge. You don't need insurance to get it, and you won't be asked to pay anything out of pocket for it. If you are, let Representative O'Neill know, and he'll do something about it. They're free, and they're here. So take advantage of that. As the weather gets warmer, more people are comfortable going out in public. As of yesterday, with the announcements, we can actually take our masks off when we're speaking, which is a great thing. So we want to make it easy to get the vaccine. If you're planning ahead for going home at the end of the semester, or if you're a student, or you're waiting for a summer vacation, there's a lot of that going on right now, or just for a family get-together, make plans right now. I'm speaking to the broader world here. Make plans now to get the vaccine. I want to thank again everybody like Washington Health Systems for doing everything that you're doing to make sure that our Pennsylvanians are protected. And I want to thank everybody who has already made your vaccine appointment. That vaccination, again, is not just going to protect you, it's going to protect everybody around you. It's a way we can each of us play a part in really beating this pandemic. So thank you very much. And now I'm going to turn it over to somebody who has been a real partner in making this vaccine rollout work. I think when you started, we were probably 49th in the country in terms of one metric of performance, and now we're routinely way above average, and as I said, in some cases even up in the top 10 or even number 1, depending on how you count. But that's in no small measure to the hard work of Representative O'Neill. It's been a real privilege and an honor for me to work with him on that task force, and I appreciate everything that he has done. along with all our other partners to make this process work really well. So let me introduce my friend, Representative Tim O'Neill.